New medical necessity determination and documentation requirements were established starting with the elimination of the Certificate of Medical Necessity, which was put into effect October 1, 2005. This was due to the fact that the CMNs for power wheelchairs and scooters did not match the new coverage criteria. Replacing the CMNs is a mandatory face-to-face examination of your patient. This is required by you, the ordering physician, before you can prescribe the power mobility device. Physician may also refer the patient to a licensed or certified medical professional, PT or OT, to perform part of the face-to-face examination. Further, the written prescription or order will be needed prior to the mobility supplier delivering the power wheelchair or scooter to your patient. For a POV or power wheelchair to be covered, the supplier must receive from the physician the written prescription or order within 45 days of the face-to-face exam, and the delivery of the PMD must be within 120 days following the face-to-face exam. Since the CMNs have been eliminated, Medicare will determine medical necessity from the patient's history through their chart, hospital, or home health notes, a face-to-face examination with the ordering physician, a physical or occupational therapist treatment plan, or physician-ordered PT/OT wheelchair assessment. As mentioned earlier, the ordering physicians are required to conduct a face-to-face examination of their patient prior to prescribing the power wheelchair or scooter. The mobility supplier must receive the written prescription and supporting documentation by the ordering physician within 45 days from the date of the physician face-to-face examination. Exceptions to this would be in the event of a PT/OT referral for the evaluation. The 45-day clock does not begin until the final physician visit or review and signature of the therapist evaluation. Also, if the examination is performed during a hospital or nursing home stay, the supplier must receive a report of the exam within 45 days after discharge. A separate add-on payment was established to recognize the additional physician work and resources required for submitting pertinent parts of the medical record. This is an add-on payment to the office visit billed with the code of G0372. If a part of the examination is performed by a licensed or certified medical professional, such as a PT or OT, a copy of that report must be sent to the physician to sign. Please note that to be considered part of the face-to-face exam, this person may not be an employee or have any financial relationship to the supplier. An exception to this would be if the supplier is owned by a hospital and a PT/OT working in an inpatient or outpatient hospital setting may then perform part of the face-to-face examination. The ordering physician must review and either note discrepancies or state concurrence with the evaluation in their patient's chart, as well as retain a copy of the PT/OT evaluation in the chart. Once again, the medical documentation provided must be related to the patient's mobility limitation and how it interferes with the performance of their activities of daily living in the home, and must support why a least costly alternative like a cane, walker, or manual wheelchair does not meet the patient's mobility needs in the home. Now that you have your documentation requirements, it is time to choose the right power mobility device for your patient.